Hello, everyone, and welcome. Today, we are going to tackle a very, very important class of drugs, benzodiazepines, or as we all know them, BZDs. I guarantee you in your future practice, you're going to be seeing these drugs day in and day out. They are everywhere, so understanding them properly is absolutely non-negotiable for a good doctor. Cello, let's begin.
So let me start with a little clinical puzzle for you. Imagine you're in your OPD. Patient number 1 comes in with crippling anxiety. Patient number 2 tells you they haven't had a proper night's sleep in weeks. And then you get a call from the emergency room. A patient has been brought in with active seizures. Now, 3 very different clinical pictures, right? But what if I told you that one single class of drug could be the answer for all 3? Well, that common link, that powerful tool, is, of course, the benzodiazepine family.
So here is our roadmap for today. First, a quick introduction to the world of BZDs. Then, we'll dive deep into the brain to understand the master switch they target. After that, we'll see exactly how they work, what they do to the whole body, meet the different members of the family, and then the most crucial part, how to use them safely. A pretty straightforward plan, right? Let's get into it. Okay, Section 1. Welcome to benzodiazepines. And let me tell you, it's no joke when we say they are one of the most frequently prescribed drug classes in the world. To really appreciate why they're so popular, you first have to understand that what came before them was, well, not as good. And this slide, this is the whole story in one sentence. The older drugs, things like barbiturates, they were like a sledgehammer. You take them and they just shut down your entire central nervous system. Clumsy. Benzodiazepines, on the other hand, are more like a surgeon's scalpel. They are targeted, they are selective, and that precision is the secret behind their much, much better safety profile. We'll keep coming back to this idea.
So the big question is, how do they achieve this precision? How are they so smart? Well, that brings us to the brain's master switch. You see, the first rule of pharmacology is, if you want to understand a drug, you have to understand its target. And for BZDs, the target is this beautiful, complex thing called the GABA-A receptor.
Now, this receptor loves a molecule called GABA. I'm sure you all remember GABA. It's the main shh signal in the brain, the primary inhibitory neurotransmitter. Just think of it like this. If you have accelerator pedals in your brain making neurons fire, you absolutely need a brake pedal to tell them to calm down. That brake pedal is GABA. Simple as that. And here it is, the whole machine. This is the GABA-A receptor complex. Now, I know, it looks a bit scary, all these subunits and labels, but don't worry, it's actually quite elegant. We're going to break it down. Just look at this as the stage where all the action is about to happen. So let's meet the cast of characters. You see the spot here? That's the main binding site for GABA, our natural brake pedal. But look, right next to it, there's a separate, special spot. That's the BZD receptor. We call it an allosteric site. It's like a special VIP entrance for our drugs. And right in the middle, that's the chloride channel. That's the gate that, when it opens, calms the neuron down. That's the entire game. Okay, now for the main event. We've seen the stage, we've met the players. How do benzodiazepines actually work? The whole secret, the Viva question you will definitely get, is in this one concept. They are facilitators, not mimics. This difference is everything. Now, please pay attention to this. Benzodiazepines cannot open the chloride channel by themselves. They are helpless without GABA. So GABA comes and binds and the channel opens. Flick. What the BZD does is it binds to its own VIP site and makes the channel open more frequently whenever GABA is around. So now it's flicker, 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 flicker. You see? It's just a helper. It makes the brain's natural brake pedal much more efficient. And this table shows you exactly why BZDs were such a huge step up from the older barbiturates. BZDs increase the frequency. Barbiturates increase the duration. They hold the gate open for longer. But here's the dangerous part. At high doses, barbiturates can force the gate open all by themselves, with or without GABA. This means there's no safety switch, no ceiling to their effect, which makes them so much easier to overdose on. Plus, for BZDs, we have a specific antidote, a get-out-of-jail-free card called flumazenil. Fantastic. So we've gone from the tiny molecule to the receptor. But what does all this mean for the patient sitting in front of you? So let's zoom out now and look at the full body effect, or really, the full brain effect. Every single BZD, no matter which one, produces these 4 primary actions. I want you to remember them as the 4 pillars. First, they are anxiolytic. They relieve anxiety. Second, they are hypnotic. They help you sleep. Third, they are muscle relaxants.
And fourth, they are powerful anticonvulsants used to stop seizures. Anxiolytic, hypnotic, muscle relaxant, anticonvulsant. Got it? Good.
So this leads to a logical question. If all of them have these 4 pillars, does that mean you can just use any BZD for any problem? The answer is a big, fat no. They are not all the same. To understand why, we have to meet the different members of the BZD family.
And what makes them different? It all comes down to their pharmacokinetics. Now, don't get scared by the big word. It just means how the body handles the drug. How fast does it get absorbed? How long does it stick around? Does it produce any active byproducts? The answers to these questions will tell you which drug to use for panic attacks and which one to use for chronic insomnia. This table makes it all very clear. Look here. On one side, you have the long-acting drugs, like our old friend diazepam. Look at that half-life, up to 60 hours. It stays in the body for ages, which is great for a chronic condition. Now look at the other end. Triazolone. A half-life of just 1 to 3 hours. It's in, it does its job, and it's out. Perfect for someone who just needs help falling asleep. This, my friends, is the art of prescribing, matching the drug's timing to the patient's problem.
And that brings us to our final and honestly the most critical section of all, using BZDs safely. You can know all the mechanisms in the world, but if you can't do this, you're not a good doctor. This is your #1 responsibility. So what must you warn your patients about? Well, things like dizziness and unsteadiness or ataxia are common, but a really important one is anterograde amnesia. They might not form new memories while the drug is active. And that leads to the single most important instruction you will ever give a patient on BZDs. No driving and no operating heavy machinery. Period. Also, watch out for a hangover effect with the long-acting drugs and be super careful in patients with sleep apnea. Now, the big question, what about addiction? Well, compared to the older drugs, the risk of dependence is low. But, and this is a big but, it is not zero. If a patient takes these drugs regularly for a long time, their body gets used to them. And if you stop them suddenly, bang, you get a withdrawal syndrome. So the golden rule is what? You must always taper the dose. Reduce it slowly, bit by bit. Never, ever stop abruptly.
And what if there's an emergency? A patient takes an overdose. Do we have a magic bullet? Yes, we do. Its name is flumazenil. You must remember this name. It's a competitive antagonist. It literally rushes to the BZD receptor and kicks the benzodiazepine off its seat, reversing all its effects. It is a life-saving drug. So what is the take-home message for all of you? It's really this. It's about being a thoughtful doctor. You have a whole toolbox of BZDs, long-acting, short-acting, and everything in between. Your job is to understand their individual personalities, their pharmacokinetic profiles, and choose the perfect one for the patient in front of you.
And I want to leave you with this final question to think about as you continue your studies. Benzodiazepines are a classic double-edged sword. They can bring immense, life-changing relief to patients who are suffering, but they also carry real risks. The question that you will face your entire career is this: how will you, as a careful and responsible doctor, balance these incredible benefits against these real risks? That's the challenge. Think on that. Thank you.